Good day. Our case study is chest CT imaging features and clinical outcome of coronavirus disease 2019 or COVID-19. Introduction. Since December 2019, a cluster of patients with respiratory illness of unknown origin has emerged in Wuhan, Hubei province, China. The confirmed cases were caused by a novel coronavirus severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2 infection, officially named coronavirus disease 2019 or COVID-19. It is a disease of person-to-person transmission. Up to March 4, 2020, China reported a total of 80,270 confirmed cases, 520 suspected cases, and 49,856 cured cases, and 2,981 deaths. At present, the disease has been spreading rapidly to 100 countries and 6 continents, leading to a serious global public health issue. The diagnosis of COVID-19 pneumonia is dependent on the epidemiological history, clinical manifestation, chest CT findings, and viral nucleic acid detection by real-time polymerase chain reaction or RT-PCR. At first, the confirmed cases were almost related to Huanan seafood market in Wuhan, China. Later, numerous cases have been reported to have direct or indirect close contacts with individuals of COVID-19 infection from Wuhan or other infected areas. Most of the patients with COVID-19 pneumonia have clinical symptoms of fever, cough, shortness of breathing, and so on. Chest CT plays a critical role in the diagnosis of disease, and typical imaging findings were multifocal ground glass opacification at the bilateral peripheral margin, mainly involving the lower right lobe. RT-PCR test remains the reference standard methods of diagnosis of COVID-19, even though with a lower sensitivity compared to chest CT imaging. However, the epidemiological characteristic, clinical imaging and manifestation, and outcome were not the same in different areas. To date, only limited cases study have reported about the chest CT findings of COVID-19 and its temporal change and relationship with clinical features. Therefore, the purpose of these studies was to explore the chest CT imaging features and clinical outcome from patients with the COVID-19. History. A 66-year-old man with a history of exposed to a patient with COVID-19 pneumonia who came from Wuhan, initial chest CT scan was performed on the day 5 after onset of the illness. Axial CT scan showed multifocal ground glass opacification with a crazy paving patterns in the upper lobes of both lungs. The middle and the lower of the right lung mainly distributed in subpleural and peripheral areas. During follow-up CT scan on day 11, 15, 19, 20, and 23, which showed the size and density of the lesion of both lungs were greatly and significantly decreased.
Anatomy of the chest. Thoracic cavity, also called chest cavity, the second largest hollow space of the body. It is enclosed by the ribs, the vertebral column, and the sternum, or breastbone, and is separated from the abdominal cavity by a muscular and membranous partition, the diaphragm. It contains the lungs in the middle and lower airways, the tracheobronchial tree, the heart, the vessels transporting blood between the heart and the lungs, the great arteries bringing blood from the heart out into general circulation, and major veins into which the blood is collected for transport back to the heart. The heart is covered by the fibrous membrane sac called the pericardium that blends with the trunks of the vessels running to and from the heart. The thoracic cavity also contains the esophagus, the channels through which food is passed from the throat to the stomach. So this is the anatomy of the thoracic cavity. The chest cavity is lined with a serous membrane which exudes a thin fluid. That portion of the chest membrane is called the parietal pleura. The membrane continues over the lung, where it called the visceral pleura, and over part of the esophagus, the heart, and the great vessels, as the mediastinal pleura, the mediastinum being the space and tissues and structures between the two lungs. Because the atmospheric pressure between the parietal pleura and visceral pleura is less than that of the outer atmosphere, the two surfaces tend to touch friction between the two during the respiratory movements of the lung, being eliminated by the lubricating actions of the serous fluid. The pleural cavity is the space when it occurs between the parietal and visceral pleura. Test and measurement. CT scan is a type of imaging test. It uses X-ray and computer technology to make detailed pictures of the organs and structures inside your chest. These images are more detailed than regular X-rays. They can give more information about injuries or disease of the chest organs. In CT scan, an X-ray beam moves in a circle around your body. It takes many images called slices of the lungs inside the chest. A computer processes these images and displays it on a monitor. During the test, you may receive contrast dye. This will make parts of your body show up better in the image.
For treatment management and outcome, the patient should rest, drink plenty of fluids, and eat nutritious foods. Stay in separate rooms from other family members and use dedicated bathroom if possible. Clean and disinfect frequently touched surfaces. Also, the patient should keep a healthy lifestyle at home, maintain a healthy diet, sleep, stay active, and take vitamins to help boost the immune system. Keep to regular routines and schedules as much as possible. The outcome of this treatment will vary depending on how the patient's body will react. In conclusion, the results show that the most common CT features are multiple bilateral and peripheral GGOs, with mixed consolidations or not in the lungs of the patient with COVID-19. Chest CT plays an important role in early diagnosis and evaluating treatment response of this disease. The diagnosis of COVID-19 should integrate the epidemiology history, clinical symptoms, and CT features. There was no reported death in this case due to small sample size. Multicenter research with a large sample size is warranted.